How is a dog UTI diagnosed? If you suspect your furry friend might have a urinary tract infection, you may wonder how veterinarians diagnose this condition. Understanding the process can help you feel more prepared and informed. Let's break it down step by step. First, the veterinarian will conduct a thorough physical examination. This includes checking your dog's urinary tract and genital area for any signs of disease or inflammation. They will also gently touch the abdomen to see if the bladder is painful. For male dogs, a rectal examination may be necessary to check the prostate and distal urethra. Next comes a urinalysis, which is a vital part of diagnosing a urinary tract infection. The veterinarian will analyze a urine sample for various components. They will look at the urine's specific gravity, pH, and check for the presence of ketones, glucose, bilirubin, blood, and protein. The sample is then spun in a centrifuge to examine the sediment under a microscope for red blood cells, white blood cells, bacteria, and crystals. When it comes to collecting urine, the best method is cystocentesis. This procedure involves inserting a needle directly into the bladder to obtain a urine sample. It is a safe technique that minimizes contamination, leading to a more accurate diagnosis. If the urinalysis shows signs of bacteria or white blood cells, the veterinarian will likely recommend a urine culture. This involves growing the bacteria in a controlled environment to confirm the infection and identify the specific type of bacteria causing the issue. This information is essential for choosing the right antibiotic treatment. In some cases, additional tests may be required. Depending on the findings from the urinalysis and culture, the veterinarian may suggest bladder radiographs or ultrasound. These tests help identify other urinary tract problems, such as stones or tumors, that could be contributing to the symptoms. Now let's talk about costs. Understanding the diagnostic process is important because it directly affects the overall expense. The total cost can include the initial consultation, urinalysis, urine culture, and any additional imaging tests needed. On average, you might expect to pay anywhere from $100 to $300 for these services, depending on your location and the veterinary clinic. Accurate diagnosis is essential for effective treatment and minimizing complications. By knowing how a urinary tract infection is diagnosed, you can be better prepared for your visit to the veterinarian and understand the potential costs involved.